Okay, so I am here with Josh Foster. And Josh, can you briefly introduce yourself to those of you who don't know you who are listening?
Yeah, my name's Josh. I'm a climbing physical therapist. I've been practicing for a couple years, starting out up in Seattle and recently relocated down to South Lake Tahoe, back home in California. Spent a little over a decade setting climbing routes and working as a youth competitive climbing coach, and love being part of the community, giving back a little bit.
Awesome. Yeah, and this episode or this session, we're going to talk about meniscal injuries, right? Knee injuries and rock climbers. And I'm excited to go through this because, again, this is a part of climbing and climbing injuries that's not talked about that much, but it's
Hmm.
happening more and more. These injuries are becoming more and more common. So I know you wrote an article about this for the blog. It's an excellent article. For people who are listening, we'll be describing some components and exercise in the article. And those of you that are watching, Josh will pull up, some aspects of the article as well. But let's just start with it. Let's get straight to it. What is a meniscal injury and why should climbers know about it?
Yeah, well, so the meniscus is a little cartilaginous structure kind of between the two bones that make up the knee, the tibia and the femur, and provides a little bit of cushion and support in the knee as we're doing all the running, jumping, and in our case, climbing activities, the heel hooking, high steps, drop knees, back steps, all of the above. We're putting some pretty good load on that meniscus. Um, so it really just acts as a little buffer and support in that knee between the two big bones that make up the leg.
And how do climbers injure a meniscus? Like how does that typically happen?
Yeah, when we're talking about a meniscus injury, like the classic mechanism of injury is compression through the knee joint. So the knee's loaded, whether it's running, climbing, doing anything that's just putting some load through there, getting some torsion or some twisting motion through the tibia or between the femur and the tibia. So little twist in the knee, and then having some bending or flexing happening at the same time. So we get this combination of forces loading through the knee all at once that tends to overload and cause that injury in the meniscus. So climbers, we're typically seeing that with our high steps, our drop knees. Can even see that with really extreme heel hooks. I wouldn't be surprised to come across it with some knee bars. There's some classic footage out there, some wild climbing competition knee bar being executed, where you just wonder how the body's holding up.
Yeah, and also probably landing too, right? Like the
Absolutely.
either it's
Absolutely.
repetitive landing or a single instance. If the ankle doesn't go, maybe there's a torsion or twist of the knee.
Absolutely. And that falls into the more like classic, how do people injure a meniscus, and that climbers are doing that constantly. That's coming off the bouldering wall.
Yeah, I've also found that climbers will come in with maybe a history of knee injuries. Maybe they were a runner in college or whatever it was, or they've been doing a lot of hiking or approaches to the climbing crags, and maybe there's something like outside of climbing that's really irritated their knee, and then it starts manifesting in different climbing moves.
Hmm.
So okay, so climber comes in, they're having some discomfort in their knee. They mentioned they were doing this like high step rock over and it's just uncomfortable. They kind of point towards the inside of their knee. Are there certain signs, like things that are classic to meniscal injuries that would be different from a different type of knee injury that climbers should be aware of?
Yeah, and so it's there's a lot of things that can happen with those kind of twisting injury mechanisms in the knee, and the meniscus isn't the only thing that gets stressed and loaded in that scenario. But when we're talking about a meniscus, the real big concerning signs are when that knee starts clicking, popping, it can actually, with a meniscus injury, it can lock in place and become difficult to bend or extend the knee. That's when we start having a little bit more concern. Joint line pain, tenderness. We can get some onset of swelling as well.
And just a pause for a second for medical providers listening, they're like, okay, we know joint line pain, but for a climber listening, like, where is the joint line? Like, can you describe, because that could be anywhere, right? Is there normally like a place to look for?
Absolutely. So, if you're familiar with the kneecap, big round patella on the front of the knee, our joint line is typically going to fall right underneath that. And if you feel down the front of your knee, you'll feel almost like a little concavity, or almost like a depression.
Yeah,
and if you
I can
keep
feel
going,
that on my knee for sure in front.
yeah, and if you keep going past that depression, it'll pop back forward and almost feel like a really defined ridge. That marks the bottom side of that joint line. And so right in there is what we're talking about for that joint line tenderness or pain, kind of in that area. And that's not, it's a really great sign. It's not the only sign of a meniscus injury. We can actually have some meniscus injuries that don't show a lot of pain there. Be a little bit more pain on the back side of the knee. So that's kind of where I jump in with the plug of, seeing your physical therapist to kind of check
Get
things
it
out
checked
and make
out.
sure we're talking about what we think we're talking about.
Yeah, and specifically the joint line, there, as many people know, or maybe some people who are listening don't know, but there's a medial and a lateral menisci. There's one on the inside, one on the outside, and typically that joint line that we're feeling for, is whether it's the inside or outside is the easiest access. But there's also some ligaments in the way, and some other structures. So I agree, getting it checked out, by a medical provider is really important. So if someone goes in, they have knee discomfort, they have some inside knee pain along the joint line, and there's like a little bit of clicking. What does a medical provider typically do? Like, what are their steps or their processes to rule in to say, oh, I think what's going on is a meniscal injury?
Yeah, so those kind of signs that we're talking about already, like looking for that joint line tenderness, the clicking, popping, are really just kind of the starting point of saying, oh yeah, my suspicion for that meniscus is a lot higher with those things. And then in line with that mechanism of injury that we talked about, with the rotation, a little loading through the joint, we've got a few special tests that we'll run through to kind of examine and see if we can actually provoke it through a less intense sort of form of that mechanism with the twisting, loading, bending, and flexing, and see if that kind of agitates the structure a little bit, the meniscus inside the knee. And if we can kind of provoke those symptoms, that increases our suspicion. Not always is it definitive, but it definitely increases our suspicion, and we kind of start moving forward from there.
Yeah, and of course, someone can get an image if necessary,
Yeah.
but I think typically a increased suspicion is enough to initiate a rehabilitation plan, and that's really in your article what you talk about, rehabilitation from after surgery or rehabilitation from having this acute, like, really uncomfortable, meniscal injury, of like the step by step process of how to go from these early stages to later stages. So yeah, so maybe break down, if you want to pull up on the screen some of the exercises from the article, and we can chat through it. But the structure of, if someone has a meniscal injury, of what they should do.
Yeah. So first thing, we're really trying to manage the symptoms and trying to keep things calmed down, keep the pain under control, manage the swelling, And then we're really going to work towards restoring any lost range of motion. Typically, we're looking at restoring knee extension predominantly, but knee flexion we're going to be really, really focused on getting as well. Here we're starting off with a little focus on terminal knee extension. Once we get pain managed, we get the swelling down. My next and really high priority is getting that terminal knee extension. And that means making sure we can get that knee all the way straight. So we spend a lot of time walking around in our daily lives, walking, standing. If we're spending all of our time in a bent knee position, we're really hindering our overall outcome and our ability to function normally in our daily life. And that's just talking about daily function before even getting to the climbing wall. So getting that knee extension, super important.
And so that would fall under basically those two exercises, like getting it bent would be these heel slides that you describe in the article, and the terminal extension. I mean, there's hundreds of ways to do this, but the terminal extension would try and get
Yep.
that straightening at the end. And really, it sounds like these mobility exercises you have early on are really just get it back into straightening and bending, right? Is that really the like checkbox? Can it fully bend? Can it fully straighten with minimal discomfort, just like your other side?
Yeah, that's the goal. That's the goal. Let's just restore that normal range of motion. So we want to restore that range of motion. And then I really like to work on restoring that muscular function as we kind of start rolling into next. We see those early strengthening. We're talking about quad sets, and we're talking about control at the knee, so that we stop kind of falling into passive movement patterns where I think a lot of the issue sometimes comes about. Get the quads turned on. We'll work on getting the hamstrings turned on. More severe injuries, it's not uncommon for those quads to have a hard time to actually fully contract and get that knee straight. So we spend a good amount of time working on that with more severe knee injuries, more severe meniscus injuries.
Yeah, and it's interesting. I had someone, I'm trying to find the exact comment. I'll have to see what they said. But I had someone comment, it was maybe a YouTube post on this article, and I had to push back on it. But they said they looked at this exercise, this quad set exercise, which is essentially someone is, you can see Josh sitting and he's like tightening his thigh muscle and then relaxing it and tightening and relaxing. And they said, like, this is BS. This isn't strengthening. This should be like called maintaining or something like that. Do you have a response to that? I love it when haters on the internet like don't say something. Like typically, if I give feedback, like in mentorship, I'll say something positive, and then I will say the constructive, and then I'll end positive. It's called SHIT filled Twinkie is kind of the like a Twinkie, like the thing that you eat. But I said that they jumped right into it. So what would be your response if someone were to say, this isn't strengthening? This is like a very simple exercise. What would you say? And I
Yeah,
could pull up my response to that, but I want to hear your
yeah,
thoughts.
You can talk about it as a really simple exercise. When we have these more severe injuries, it's pretty astounding how challenging this exercise becomes. It's not invalid to discuss it as a sort of maintenance sort of approach to the quadriceps, but it is we talk about that neuromuscular control. The muscle has got the strength. The physiological cross-sectional area is how we talk about muscle strength. And right after an injury, that hasn't been lost. The atrophy is relatively minimal. But what is lost is that connection from the brain to the muscle that really turn it on and get that full contraction. And if you don't restore that muscle will atrophy and it will become a problem down the road where the actual strength of the muscle is gone.
Yeah, for
So
sure. And I think
it's a
Oh no, sorry, keep
It's,
going.
yeah, it's a multifaceted sort of approach towards kind of understanding what's going on with the strength of that muscle.
Yeah, and I look at it because it's strength and neuromuscular education, but also to think about if someone is post-operative, this is truly strength. Like if someone
Hmm.
does have a meniscal injury and you just had surgery, just tightening your muscle 10 times against gravity is a strength exercise. Well, I guess technically 6 times. But if you are fatiguing and unable to do it more, and because oftentimes you get stiffness in the knee, it's hard to fully straighten it. Now doing this end range exercise, you're working against your own resistance, from the joint and from the hamstring. So anyway, I don't
Yeah.
want to tangent too much on that, but I always find it interesting. These articles get a lot of eyeballs and comments, and there's some amazing, like, people are like so grateful for things. Then there's some shit talkers, and then there's some like constructive feedback, and it's trying to find the balance
Yeah.
between each. Um, all right, let's see what else. What else do you do? So you have these contractions of your quadricep muscle. What else?
Yeah. Oh, well, and then we start talking about once we can get that quadricep turned on and really in that difficult end range, working on those quad sets, then we want to start working on actually controlling it through a range of motion, right? These are exercises that typically are going to be used with a more severe meniscus injury. But as we start getting into like short arc quads, we might then go into long arc quads as well. We start building on some progressions as we'll potentially touch on here in a minute, towards just getting an increased load on those quads.
Okay, and why are the quads, like the quads, the muscles in the front of the thigh, why are those so important after a meniscal injury?
Yeah, we're talking about support around the knee, and we talk about the knee joint. We're predominantly talking about just a flexion and extension, a hinge joint, kind of moving in two directions. Now, where that meniscus gets challenged is we've also got just a little bit of that rotational component that we need to balance and control. Now, we're kind of working on that stability in the front side with the quad. Really important anti-gravity muscle. Without the quads, we actually can't stand up, right? And if we think about climbing, because that's what we're all focused on, it becomes really hard if we lose a little bit of that control on the quads to just kind of drive our body weight up the wall. A lot of us like to do the upper body training, focus on it entirely, but we do a lot of work with those legs on the climbing wall.
Oh yeah, so
Um,
important.
so talking about that rotational component, we kind of move into bridge exercises in the posterior side of the knee and looking at those hamstrings. Uh, just like the quads, we want to make sure we're maintaining strength, building strength, and getting that control really dialed. So
So the bridging exercise. I'm assuming you use two legs, and you can progress that. Like you're lying on your back, your knees are bent, you're lifting your hips into the air, and you progress that to doing it just on one leg.
doing it to just one leg, we can progress it even further by moving those heels out away from the hip. There's a million different ways to vary and progress it. A really great thing about going into the single leg variations is we start getting a little bit of that rotational control through the hip, and that will translate minimally but effectively through the knee as well to minimize any sort of rotation twisting movement in the body.
And I'm assuming too, you mentioned the lower leg can turn, kind of causing the meniscus to have some almost torsional rotational pressure. I'm assuming during these exercises you can turn your lower leg, your foot, right, and that would turn your lower leg outwards, especially even
Yeah,
during that bridge, right, to load different hamstring muscles a little bit more during the bridge.
yeah, and so we start getting into some nuance of kind of bridge variations, and really we can start talking about progressing loading in general, where As we bring those heels out a little farther, we're going to engage the hamstrings more. As we start engaging the hamstrings more, then we can start biasing medial hamstrings versus lateral hamstrings. We've got kind of two prominent lines of action through the hamstrings that's actually tugging on either side of the knee, where I would say we get the majority of that rotational control, especially when that knee is bent. I've even got in this article, I'm going to scroll up here and talk just a little bit about kind of position on the wall. And we can see the heel in line with the wall here in this first kind of back step image, as opposed to this image coming up here a little bit higher. We've got this tibial rotation happening where we just don't have that rotational control.
Yeah, and I'll just
We've
break
got that.
this down to people who are just listening. Josh is doing a drop knee, and he's basically doing a drop knee with his heel facing up, and then he's doing a drop knee with his heel like twerked outwards without as much stability and control.
Yeah, head-on photo and the heel facing right at me, and then another head-on photo where the heel facing up towards the air, like up towards the sky. And so that kind of illustrates a little bit of like what we're talking about with that torsional component at the knee.
Yeah, and it's very common, like for climbers, I see it all the time. Even like heel hooks, we have to rotate our toes outwards sometimes, which rotates our lower leg bone, which rotates our knee. And that biases a lot our outside hamstring muscles. It's biceps femoris is the muscle. And so, yeah, with climbers a lot, I like to play around and bias, trying to really strengthen the inside hamstring muscles to kind of balance some of those stresses. But I like how you have this laid out. You have these initial strengthening neuromuscular control exercises that focus on the muscles that cross the knee joint. And they're pretty manageable unless you're in a lot of pain or it's postoperative. But how do you step that up? How do you start getting into what would be considered more weight bearing, stressful exercises that are gearing towards looking more and more like climbing?
Yeah, so single leg activities are kind of the target goal here before we really start getting crazy. The single leg RDL, we start kind of looking into a little bit more of the posterior line. We talk about glutes and hamstrings. So we take moving from the bridge to a standing position, working on the hamstrings, glutes, the backside of the knee.
And
And
how would you
kind of,
describe that? How would you describe like what for people that don't know, like what a Roman deadlift or RDL, a single leg RDL looks like?
yeah. And I'll get that. We're going to get that. The hip hamstrings while you're working in the single leg RDL. Really, we can start with a two-leg RDL, but really we're talking about a hinge pattern similar to a deadlift pattern with a little bit more of a straight knee. We can kind of talk to towards the ends of the earth about straight knee versus bent knee, conventional deadlifts, Romanian deadlifts, but the goal here is to load the hamstrings and the hips in a hinging pattern where we're going to be a little bit more biased towards the backside. Torso is going to lean forward. We're going to keep a relatively straight knee. Knee is going to be relatively over the feet in this position, and that's going to bias our hips and our hamstrings, as
Yeah, and
opposed
it's
to
oh sorry, keep going.
a little bit more of a quad dominant posture where we're in more of a squat position, knees moving forward over the toes.
Yeah, and a Roman deadlift, obviously you can load up a ton of weight on a bar and make that really heavily strength focused. The nice thing about a single leg Roman deadlift, since you're just on one leg, I mean, you're challenging a lot also balance and stability. And guess what? You don't need a deadlift 400 pounds to flash a V10, you may need to be on one leg and be able to balance and coordinate your body weight with a little bit of added load. So I like how these are quite functional, but also you can add load to any of these exercises to make them more and more strength based.
Absolutely.
So what comes
So,
next? What other exercises are in this mid to late strengthening phase for menisci injuries?
yeah, so we go from that posterior line glutes hamstring dominant pattern, that hinge pattern, to a little bit more of that squat pattern. And here, when we're talking about these single leg heel taps, we're really talking about a progression into a single leg squat. A lot of climbers are familiar with like a pistol squat is really the end goal of a body weight single leg quad dominant exercise here. And so in a rehab progression for any knee injury, especially for this meniscus injury, we're looking at having a really stable pattern with that knee traveling forward, reaching a depth where we can control that knee without it wobbling side to side or getting that rotation in the pattern, and coming right back up pain free. And just progressing that as far as we tolerate, building that strength and stability in that, again, that single leg position. I'm a huge fan of single leg exercises for climbers, mountain athletes, anybody who's out there doing these kind of non-linear activities, so to speak.
Got it. And is there anything else in this kind of mid strength range, strength phase that you'd recommend?
Yeah, so kind of beyond just working on glutes or kind of glutes, hamstrings, quads, we can really talk a lot more about hip drive, hip rotational stability. If we wanted to go on a tangent, we could start talking about like the role of the popliteus in knee stability and control when we're talking about rotation, but that might be for another discussion. But I would say the hip drive is really huge in being able to support lower extremity alignment for the whole leg. I spending 10 years as a climbing coach, I can start talking about how we need to turn the hips out, how we set the heel hook, and actually, as we bias the lateral hamstrings, the outside hamstrings, to get the heel hook in the spot where we want, then we really need to start talking about activating the medial hamstrings to really lock that heel into place and keep some active stability in that movement.
Yeah, I think
So
there's so many nuances of this like rotation side to side or this abduction where the limbs go, away from or in towards the body that you're mentioning that are so important as this next layer. And I think what this article does really well is the article sets the foundation. Like this is really nice that it will give anyone who's obviously use this article under the guidance of a medical provider, a physical therapist walking you through it. But it does set that foundation. And then knowing there's many other ways to, amplify or step up some of your rehabilitation. I like how you break it down as well into these strength exercises, but then you move into, no pun intended, movement. And that's where I'm really excited. First of all, you shot some cool stuff on the wall. And by the way, is that your home wall or is that a buddy's or what's the story on?
that's a good friend's home wall. Yeah, and that home wall has a whole story of its own, having been transported from one backyard to another with a really huge community lift. Uh,
Well, if they're
literally and
if they're
figuratively.
moving at all anytime soon and they need to store it in Southern California, I'll take that into my backyard because I these are, and just people who are listening, this is the wall that Josh shot the photos and videos on for the article, and there's like cracks like built on the side. I think there's a hand crack and like is that a fist or like a number 5 crack on the far left?
It's a fist. Yeah.
That's a fist. Okay.
Yeah.
So yeah, fist crack and a hand crack, and that's a good training wall.
Oh
Pretty
yeah.
nicely done.
And
But
a
anyway,
and
so
a
break. Oh, sorry. Go for it.
oh and a plug to my buddy is some of the holes on that wall are custom made in his own clay oven.
Oh wow. Yeah, that is
Yeah.
awesome. All right. Well, so break down the movement, because I think this is what's really unique about climbing is there's so many different movement variations, and especially with your background, of coaching and understanding body position. What advice can you give on the movement realm as it relates to meniscal injuries and climbing?
Yeah, so setting with a foundation, really getting aware of those glutes, those hamstrings, those quads, and then starting to take that foundation, move it onto the climbing wall. I really I really think there's a lot of value in starting with a really low level load and just practicing these movement patterns and really talking about some of the primary movement patterns where we're challenging the knee, the heel hooks, back steps, drop knees being the primary things I talked about in this article, but not the only way you can kind of challenge and overload the knees. But starting first, hands on a climbing wall, 1 foot on the ground, 1 foot on the wall, starting to just mirror the pattern of the movement. Get your foot up in a high step, but keep 1 foot on the ground, and just practice that rotational control. Practice engaging the hamstrings as you rock up towards that body position, that hips over heel position, while still keeping 1 foot on the ground. So you're really minimizing how much load and stress you're putting on the knee. However, still practicing the movement pattern just as though you're doing it on the wall.
Yeah, I like that because obviously the idea is that it minimizes load, right? And
Mhm.
also it's safe, right? Because there's some fear. Obviously, if someone's post-operative or has just had an injury, there's also fear jumping back and loading back on the walls. This sounds like a nice progression: decrease load, decrease anxiety and fear, to try and get back to those movements. What else? What other kind of progressions do you have in mind?
Yeah, and kind of continuing on that progression where we can really get yourself continuing to be on good climbing holds, setting up actually on the wall, both feet on the wall, and just moving casually in through the move, not making any foot movements, not making any hand movements, but just practicing movement. Get your so continuing with the high step example where you set a high step on the wall, bring and keep the other foot on the wall at the same time, or you might even start with 1 foot on the wall and then bring the high step up for that knee that we're rehabbing. And then just practice rocking towards the knee, rocking over that foot, coming back off of that foot. Again, keeping all of that control in mind, right? From that coaching perspective, I like to talk about where we think about how we're going to be effective at moving on the wall. Opening up that hip requires a lot of that hip drive that we're working on in the bridges and the other strength, the single leg RDLs that we're working on in that foundational piece. Tying that into the wall, and how do we get that hip open on the wall, really get those hips close to the wall, and be effective as a climber, while then translating some active stability and control through the knee, not passively rotating through that tibia and loading up that meniscus, but actively driving your body movement over that foot.
Yeah, and I think these exercises, I mean, obviously you put together this article specifically for meniscal injuries, but climbers should just spend time on the wall moving, like just what you were describing, right? And oscillating and changing positions and feeling what that position feels like on their body. So I think these videos that you've included in the article are quite helpful, not only for people with meniscal injuries, but also just maybe even looking to prevent stressing and loading the knee, without having, if they don't have these proper movement patterns ahead of time. Are there any other kind of final thoughts that you have that are related to meniscal injuries in climbers? Any kind of take home messages or words of wisdom?
You know, I hate seeing people injured. And so my final thoughts really come around to, for anybody who's listening to this that doesn't have a knee injury, I want you thinking, how can I prevent myself from getting in that position? Uh, One of these articles, a climbing specific article, looked at these knee injuries, non-competitive climbers compared to competitive climbers, and we see that those competitive climbers who in my experience, I'll tell you, they're doing a really, really high level intensity of these high load torsional movements on the climbing wall, and their meniscus injury rates are a lot lower. Now we can talk about fatigue, we can talk about strength training, we can talk about neuromuscular control, like that awareness of your movement on the wall. All of these things are playing a factor in keeping these athletes from having that higher rate of injury. And so I encourage anybody who's not injured to not be dismissive of doing some of this lower body training and strengthening, building some of this awareness and being thoughtful, not just about, am I getting that heel hook and pulling really hard on it, but how am I actually actively recruiting my body to not only keep myself from getting injured, but also to be a better rock climber, because that's the goal for all of us.
Yeah,
Yeah.
absolutely. Josh, where can people find you? You're in Tahoe right now, right? Practicing.
Yeah, currently I'm at a PT Revolution in South Lake Tahoe, and I'm available to kind of outreach and consult with climbers anywhere, because climbing's my jam. So
Awesome.
yeah,
And I'll put any contact info or anything that you want people to reach out to you in the show notes. But it's always a pleasure connecting, and uh, and I know that we both share our passion for climbing and also for skiing. And so I may be in your neck of the woods come next ski season to hopefully we'll get snow's good right now. I mean, recording this right now. It's March, right? You have some decent snow at the moment.
oh man, these last couple of weeks have been just outrageously good.
All
Yeah,
right. Well, for me, it's always a toss up. A good ski season's a bad climbing season, and a bad ski season is a good climbing season, just, outdoors conditions wise. But you can't have everything. Always a pleasure, Josh, and I look forward to connecting. Thanks for coming on the show.
excellent, Jared. Thank you.